You know the feeling. You're sick, you feel awful, you finally get in to see the doctor, and they tell you to just wait and see. It can be so frustrating, right? But believe it or not, there's a really good reason for it. So today, we're going to pull back the curtain and look at the official playbook that doctors are using to make that exact call. I mean, this is the big question, isn't it? Why can't I just get some antibiotics? You're miserable, you're coughing, your throat is on fire, and you just want something to make it stop. I totally get it. But there's a powerful, science-backed reason for that wait-and-see strategy. And I promise, once you get it, your next sick day might feel a whole lot different. All right, so first things first, your doctor isn't just winging it. Nope, they're actually following a super detailed playbook. This comes from the UK's National Institute for Health and Care Excellence, which is just a fancy name for the experts who create these guidelines. Think of it as their go-to guide for all those common illnesses we all know and, well, definitely don't love. Now, this is absolutely crucial. The whole point of these guidelines isn't to deny you treatment. It's to make sure you get the right care at exactly the right time. Because here's the deal. Throwing antibiotics at everything is a huge problem. It leads to antibiotic resistance. Basically, the more we use them, the more the bacteria learn to fight back, creating superbugs that are way, way harder to treat down the line. So it's all about being smart and precise. So, what's the first play in the book? Well, it's the one you've probably heard before, the wait-and-see approach. For most of the stuff that sends us running to the doctor, this is the standard starting point, and for a very good reason. And here it is, straight from the source. The guidelines are super clear. For most of these common bugs, the best move is either no antibiotics at all, or what's called a delayed antibiotic prescription. That means the doctor gives you the script, but you only fill it if you're not starting to feel better after a few days. Why? Because most of these infections are caused by viruses, and antibiotics do literally nothing against a virus. Zero. So what kind of sickness are we talking about here? Oh, just the greatest hits of feeling miserable. The common cold, a sore throat or tonsillitis, that nasty cough or bronchitis, sinus infections, and even most ear infections. For all of these, your body's own immune system is the real hero of the story. Okay, but it's not always wait and see. Of course not. The playbook has some really important exceptions. So let's look at the situations where your doctor might say, okay, let's think about an antibiotic here. And the guidelines get really specific. For little ones, kids under 2, an ear infection in both ears is a big flag. Same goes for any child who has discharge coming from their ear. And then there's that sore throat, the one that feels like you're swallowing razor blades. For that, doctors have a special tool they can use. That tool is called the Centaur criteria. Just think of it as a quick 4-point checklist a doctor can run through right there in the exam room. Its whole purpose is to figure out the odds that your horrible sore throat is actually caused by the Strep A bacteria, which is one of the few things that really does need an antibiotic. So what's on this magical checklist? First, they're going to look for any white spots on your tonsils. Second, they'll check if the glands in your neck are swollen and tender. Third, have you had a fever? That's another point. And number 4, and this one's a little weird, is the absence of a cough, because a cough usually screams virus. Now, check this out because this is wild. Even if you score a 3 or a 4 on that checklist, it's still pretty much a coin toss whether you actually have a bacterial infection. There's only a 40 to 60% chance it's strep. This is exactly why the guideline says to consider antibiotics, not to just hand them out automatically. It's all about playing the odds. Okay, so we've done the wait and see, and the maybe. Now let's talk about the definitely. These are the situations where the guidelines are clear. Antibiotics are recommended right now. This is for patients who are at a higher risk of things getting serious. So this is where a doctor's judgment is key. If you are just sick all over, feeling profoundly unwell, that's a major red flag. Same goes for any signs of a serious complication, like pneumonia. And of course, if you have certain pre-existing health conditions that make it harder for your body to fight off infection, antibiotics are the way to go. The playbook gets even more specific when it comes to older adults with a bad cough. Take a look. If you're over 65 and you have 2 or more of those conditions listed, like diabetes or recent hospitalization, you'll likely get antibiotics. If you're over 80, you only need to have 1 of those conditions to qualify. It's all about protecting those who are most vulnerable. Okay, let's be honest for a second. A huge part of the frustration with being told to wait and see is that we have no idea how long we're supposed to wait. We just want to feel better now. But understanding the typical timeline for these illnesses, it can be a total game changer for your peace of mind. So get ready for this. A sore throat It can stick around for a week. A plain old cold, a week and a half. That awful sinus pressure, 2.5 weeks. And that nagging cough from bronchitis, a whopping 3 weeks. I know, 3 weeks for a cough feels like an eternity, but it's actually totally normal. When you see it laid out like this, that wait and see advice starts to make a lot more sense, doesn't it? And really, that's what this is all about. This knowledge isn't about being told no by your doctor. It's about understanding the why behind their decisions. When you know the playbook they're using, you go from being a frustrated patient to an informed partner. You can have a much better, smarter conversation about your own health. So here's a thought for you. The next time you're feeling under the weather and you're thinking about heading to the doctor, think back to this playbook. Knowing about the different paths, the timelines, the criteria, how does that change things for you? It's definitely some powerful food for thought. And a huge thank you goes out to Dr. Mohammed El-Nagi Mohammed, who prepared all the fantastic information that made this explainer possible. Thanks so much for joining me.